Dr. Jackie Pulver, and today I'm going to talk to you a little bit about foxtails. Foxtails are a very common weed we see in Nevada. You may have seen these in your yard. They're very abundant, and we see these coming up in the spring looking more green, as this one does, and then as summer and fall come along, they do change to this more golden yellow color. Foxtails sometimes can be confused with goat heads, but they are different weed species. Foxtails can cause many problems in our pets here in Nevada. Problems we can see is the small fronds from the top of the weed detach. And imagine this is your pet's skin. Once they detach, they can move through your dog's skin and into the deeper tissues. As you can see, they only move forward. They never move back. And as this happens, they can cause wounds that will actually fester and look like draining tracts or even pimple type lesions on your dog. With foxtails, these wounds, if left untreated, can cause serious infection, and actually some have been noted to travel into the abdominal cavities and other areas of the body. We don't only see these on the dog's feet and legs, but we can also see these in the ear. When they're in the ear, you may see your dog shaking its head or pawing at its ear. These can move through the eardrum and cause some severe injury within the ear also. At home, things you can do to help prevent foxtails. One would be removing any of these weeds that you see in your yard and trying to remove the debris from them. Another thing that you can do is you can also check your pet daily for any of the small fronds attached to their fur. Look carefully on long-haired dogs and look between their toes, in their fur, and in their ears to check to have any to be removed. Another thing that you can do is also bring your pet in if you see any wounds that you're fearful might be a foxtail that has actually entered the skin. If you bring your pet to Bering Boulevard Vet Hospital with a suspicious wound, we may be able to look at the wound just on our physical exam and see if we agree that it might be a foxtail lesion. If it is, sometimes we can remove these just with gentle restraint and opening a small pustule or a raised lesion on your dog. Many times we do have to sedate these dogs so that we can go and further open the wound and remove one that may be buried deeper within the tissue. If this occurs, they usually end up needing antibiotics and some pain meds to go home. Recovery is very quick from this once we remove the foxtail. If you have any further questions, you can always call our hospital. The number is 775-358-6880, or you can also look on our Facebook page for more information.